All right, Dr. Gao, we are live.
Perfect.
Good afternoon. Today is February 3rd, Wednesday. This is our weekly event. Now, I don't have to probably just say this every week anymore, right? Hopefully. This is American Surgery Center, the Bariatric Center of Excellence in Delaware. My name is Kemal Erkan, and I'm the chairman of the program. I have Dr. Isaias Irgau with me, who's our medical director for the program, and as we discussed before, we are going to cover different topics every time and try to divide the bariatric into several sections, and then we are going to cover those in a smaller videos. And today is one of those sessions that we have. So I'm going to ask Dr. Irgau to introduce himself, and we'll start from there.
Thank you, Kemal. Good afternoon, everybody, and thank you for tuning in. I am Dr. Irgau. I am the president of CHRIAS, or Christiana Institute of Advanced Surgery. My specialty is bariatric surgery or weight loss surgery, and I have been performing bariatric surgery now for almost 20 years. With my colleagues at CHRIAS, we are by far the most experienced group when it comes to bariatric surgery, not only in the state of Delaware, but also in the region. Again, thank you for tuning in.
Thank you, Dr. Irgau. So I'm going to start the presentation part. I do want to make sure that we mention our other surgeons of the program and other providers. Sorry, we were having some YouTube issues. We are okay now. All right, so we have several other surgeons in the program. Other than our program director, Dr. Irgau, we have Dr. Gail Wynn. Dr. Wynn is the most experienced female surgeon probably in the East Coast in bariatric. So we have Dr. Mike Peters, Dr. Rahul Singh, Dr. George Ibrahim as bariatric surgeons. And then we have Dr. Sachin Wade, and he's our colorectal surgeon. And our surgical PA is Sydney, and she's part of the program for a long time with us. And our nutritionist team, Amy, Beth, and Fran, they are working with our providers, our patients directly, and we can appreciate enough for their work because they are part of the program for each month. Patient is in the process, they have to be with us. Now, we are different in many ways. So I do want to, I did my homework this time a little bit more. So it was 2 years ago when we have our Center of Excellence for Bariatric, when we got that certification. That time there were 14 surgery centers in the United States out of 9,300, which are certified by MBSA QIP for a program that certifies surgery centers for bariatric. And right now there are 10 in the country. So these 10, there are 2 in Washington State, two in Georgia, 1 Kansas, 1 Arizona, 1 Indiana, 1 Oregon, and the only one that we have in the Northeast or the East Coast is American Surgery Center, and I am extremely proud of the accomplishment that we have. Other than our Bariatric Center of Excellence, we are also Blue Cross Blue Shield BDTC Distinction Center, and we are the Distinction Plus. And also for Aetna, we are one of their quality institution for the bariatric excellence. So we got these certifications in the last 24 months. So these are important because bariatric is an important issue, important surgery. And it's, although we try to make this process as simple and easy as possible, the perception in some cases, and just the changes that we have to make, it's important for us to have a good, experienced team in place. So what makes us unique in so many different ways is the total number of cases we have done in the last 20 years in bariatric. There isn't probably any other group closer to our numbers by surgeon. And also when you have new surgeons joining to you, working with the experienced surgeons also is the key in terms of the team approach. So that's why we would be separated from the rest of the programs. Now, Dr. Irgau, you and I, we started the bariatric part of it at the Surgery Center, although Surgery Center has been there for a long time. Now, if I may ask you what your initial perhaps challenges were for the Surgery Center, and then we are going to start talking about our care coordination topic after that.
Absolutely. So clearly, the greatest advantage of having the procedure being undertaken at a surgery center, Kemal, is that we can create an environment which is totally focused on those patients. And also, from an individual patient point of view, there will be a much more focused attention from the staff as well, because as opposed to a hospital, in a surgery center, there's only a limited number of procedures that occur at any one time. And especially when you take a center like ours that is devoted so greatly to just bariatric surgery, you can, and has also nurses that not only are trained for bariatric surgery, but some of them are actually certified to be bariatric specialist nurses, then the attention that patient gets, just you cannot get in a hospital setting, just because the hospital has so much more in terms of the attention that it needs for the different specialties that are undertaken in a hospital setting. So doing it in a surgery center is really great in terms of quality, in terms of experience of the patient as well, on how pleasant it can be, although it is surgery that they are undergoing. So really getting this at a surgery center was an important goal for us for a long time. But what were the challenges? Well, the challenges were obviously getting the right setup, getting the right staff, getting the right environment. And you and I have worked for a very long time to get to that level before we were able to start this process. Clearly, the most important and determinant factor, as you and I have decided from the get-go, is to have an experienced team of surgeons. That just goes without saying, right? You cannot have surgeons who are just beginning to do bariatric surgery undertake this in a surgery center. You need surgeons that have many, many years of solid background. And CHRIAS just fitted this perfectly because, as you know, my partners and I, not only have we been performing bariatric surgery now for the longest period of time compared to any other program in our surrounding, but we actually have set up programs in the area's major hospitals. So if you take the hospitals in our area, in each one of them, we started the bariatric program. And there was no bariatric surgery before we started them in these hospitals. So when it comes to experience, we had it. When we needed the most important asset to start the program at the surgery center, we had the asset. We had the most experienced surgeons. Once we established that, then the other points were for us really to get the equipment we needed, the surgeon, the staff we needed in terms of the nurses, the anesthesia team that we needed, and we put that in place from the get-go because we knew what we needed. And guess what? As soon as we started, the outcomes was excellent from the get-go. There was no learning curve at all because we had set up everything in its optimized state. And it's not a coincidence, Kemal, that when you had the certifying agencies come to our surgery center, whether it's for the MBACQIP or whether it's for the other certifying agencies, there were no issues. It was all check, 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 because we had accomplished and fulfilled all the necessary things that they needed, right? Now, the one issue that was very important for us also was to have a bariatric coordination team that would be navigating the system alongside the patients so that the patients are prepared in an optimal fashion as well. And we set that up. And it wouldn't be surprising to me that if we find out that we have one of the best bariatric coordination teams in the country, Kemal, because the way we run it, the way the meetings are undertaken, and the way we have trained the bariatric coordinators as well.
So let's actually talk about that a little bit. So I do mention this in different sessions, but the discipline that we have in terms of case conferences, we do every day 1 hour with the entire team who are involved with the process, with the care coordinators, care managers, surgeon, the facility and myself, we go through, and the dietitians, we go through this together. Well, part of the multidisciplinary approach that actually forces us to take that type of maybe that type of approach, but the issue is we have the freedom to do that, right? So we didn't have the same freedom to do that. Interestingly, Dr. Gill, like I always struggle with this issue of the perception. You know this better than anyone else in terms of my perception issues with the society. Like the hospitals do have this, you know, oh, like if this hospital is better. Well, this is not the case. So for this type of a procedure, we have our quality or our approach is an A plus approach versus maybe we are dealing with B minus or C pluses, and that would be the hospital system. So I say this very openly because for us to achieve the level that we are at today with the Bariatric Center of Excellence certification from different programs, it's not easy. Now, knowing that, we were able to have a good care coordinator and care manager team, and this team is helping us in every different direction because patients are, regardless of how we approach it, patients are, it's a challenge for them. So they do struggle. And the easiest way that we can do is having one of our care coordinators to be the contact person. So when they have an issue with their process, they talk to one person instead of calling the office and then not knowing what's happening. So as I mentioned, the way that we have right now is we have our care coordinations, and then I got the pictures. I thought Rika was going to send me a different one, but she didn't. But we'll take this one. Maybe next time she'll send a different picture. But these individuals here, Bambi, Francisco, and Rika, they are our care coordinators and they talk to our patients just like our care managers, our nurses who are doing the similar job. And then more like prepping the chart, prepping the patient. You may be talking to Hilal, Damla, or Saisa. And now we did, maybe didn't get the picture of IBK. IBK is our care manager supervisor who's been in the care coordination case conference process with us. So you may be hearing from these individuals when you are starting the process with us. Their main job and their only job is to keep you like more like problem-free communication, so then they know exactly what is needed, and then they would be there until you finish your surgery process. So then that's the main reason. Now, Dr. Yao, from the care coordination standpoint, I know we are discussing the issues, why they would be, why it's needed to have someone, but I don't talk to the patients as much as you do, obviously. So this challenge that they are, when they start a program, they go through this fear in some cases. Many of their friends are saying, oh my God, you're going to get your stomach taken out. Well, you know, but my BMI is 55. So they're not freaking out on that, but they're freaking out on the solution. So the care coordinators are doing a really fantastic job to not only follow up with them, but keep the process as smooth as possible. But how is the feedback that you get from the patients, and why, in your opinion, why this is so important for the program?
Absolutely. So that is a question I ask every patient that is going through the process when I meet them, either for a follow-up in the office or when I'm doing endoscopy, for instance, as part of the preparation. You know, when I meet them in the preparation area just before the endoscopy, I go over the procedure and then I say, hey, how is the rest of the process going? And almost always I get a positive feedback, because they tell me that their bariatric coordinator has been really very diligent in helping them through the process. And why is that help so well recognized by the patient? Well, because the process can be very cumbersome if a patient is left by, to their own, on their own means to navigate it, right? Because it requires appointments with different specialists. So just imagine if I, as a surgeon, prescribed all those needed requirements to the patients, and I tell them, okay, fulfill all that and come back and see me in 3 months' time, right? It would be very difficult for patients to do that by themselves. And the reason is because each appointment that they have to undertake may result in further appointments and further tests, right? And getting the results of those and understanding the necessity of following up with a particular test is requires somebody with some knowledge, somebody that is doing it day in and day out. Just by themselves, the patients will have great difficulty, and very often they may even give up in the process if they are not guided. So for them to have a coordinator assigned to them that will be reaching out to them at various intervals through the process to make sure they are getting the right information, to make sure they are following up on the consultations or on the tests that they have been assigned is very important, right? Now, this makes not only the process a lot easier for the patients, but it makes their buying into the actual process a lot better as well. Because come on, if you go into something that you don't understand very well, you just know that it is necessary, but you don't understand very well, and then you find obstacles in the process, your mindset may not be positive as you get into it, right? And that positive and that happy relationship with it is important when it comes to the outcomes later on as well, right? It has an impact. How was your experience through the process? A person who says it was great and a person who is not so happy about the process may have different outcomes in the long run, if you think about it. So really, this is very important, not only in facilitating the actual physical process for our patients, but maybe even in having an impact in the outcome in the long term.
Well, that's
The bariatric surgery is a serious surgery. There's no question about that. I mean, as you correctly said earlier on, the struggle patients have before they decide about bariatric surgery is because they see the magnitude of the surgery right in their face, but they miss the danger of obesity. Although it's right there, they miss it, right? A body mass index of 50 or 55 is a dangerous condition for anybody, Kemal. You and I know it very well. But for the patient to realize that it will take time, right? So for them to come to terms that the actual risks of the surgery are way lower than the long-term risks of obesity, to come to that realization, it takes time, right? And that's the struggle patients have when before they come for a consultation for bariatric surgery. You know, it's not unusual when I ask patients after surgery, several months after they've lost weight and their diabetes is better, their high blood pressure medications have been reduced, I tell them, do you have any complaints? You know, is there anything that you are not happy about? You know, one of the common things they tell me is, oh yes, I have a complaint. I wish I had done this 10 years ago. I wish I had done this many years ago, right? Because looking back, they say, why was I waiting? What did I do? Well, it's because there was this misunderstanding about the magnitude of the surgery. Well, there's no question about it. The surgery has magnitude, but it is a necessary surgery. It is a critically important treatment for them.
so. This is just the way it is. It's kind of like complicated, uh, and that's one of the main reason that you have an assigned person, right, Dr. Gaz? So we have, uh, several visits with our surgeons, dietitians, and there's lab work that needs to be done. There is the other specialists like such as cardiology, pulmonary needs to be checked. But one of the really important part that you just mentioned, the end of it. So what is the satisfaction that we are getting from this, right? So I'll just take you directly to patient satisfaction. So these are just recent two that we have received. Um, I manage or I'm involved with so many different practices. Uh, Surgery Center is unique from this point, where our patients are taking their time and write down their individuals that they dealt with. Our nurses are from the time that they get into the lobby to the time that they're discharged. And these are real. I didn't make any changes. In fact, I didn't even put this together. This was done by our business development. So we have right now the satisfaction in the last 12 months is at 100%, 100%. So the only way that we are able to reach out to this, why this is important, is because we understood that care coordinators, care managers are making this process as smooth as possible and as easy as possible. So then these individuals who are dealing with obesity, morbid obesity, they have a way out and live their life in a much healthier way. Now,
Absolutely.
the one of the other reminders that I have, Dr. Gao, for this coming Wednesday, next Wednesday, we have one of our diabetes events, which actually is for patients with diabetes after bariatric surgery. So this is one of our surgeons is going to be the panelist, Dr. Mike Peters. So this is going to be next week on Wednesday at 7 p.m. If anyone is interested, actually, I do want to make sure that we mention this. Now, uh, but we did talk about different settings, and if I were to ask you 5 years ago, you had you were doing this at the hospital setting only, and then in terms of the patients, the way that you were, like from the surgeon standpoint, how do you find this system much better, or if it's better, if when you do when we do it at American Surgery Center?
Well, there's no question about that, Kemal. I mean, clearly there are some patients or some procedures that are appropriate in a hospital setting. There is no question about that. But for the vast majority of bariatric patients that are well prepared, in terms of preparation from heart doctor, from the lung doctor, from the psychologist, and with all that preparation, the vast majority of patients actually can be safely done in a surgery center setting. Well, from my point of view, actually that makes my job a lot easier because that surgery center is really focused on my own specialty, right? I'm not going to a hospital where I am competing with the needs of many other surgeons of many other specialties, right? Of course, the hospital will try to accommodate all of us, but it can never be the same as a surgery center that is focused only in accommodating me on that day, right? So from my point of view, I feel at my best when I am there because I have all the help that I need that is just focused on what I am doing that day. So having that set up, is a dream for any surgeon to tell you the truth. So that's from my point of view. And then how about from the patient's point of view? As you mentioned, the experience that the patients report is absolutely great, although they are undergoing surgery. And the reason is because you are really preparing everything specifically focused on that patient, right? At that hour, in those moments in which the patient is at the surgery center, everything from everybody at the surgery center is focused on that patient. There cannot be any better experience in a treatment setting than that. So for the patients that are appropriate for the surgery center, I think they get the best experience. And for us as surgeons also, really it's the best environment. Having said that, obviously there are clearly situations where a hospital setting is appropriate, and we are very, very experienced in determining that, obviously, beforehand.
Absolutely. Well, Dr. Gal, we are, as everyone knows, we are going through a pandemic, and you and I, we are two maybe kind of outliers in terms of optimism that we have, and try to get some good out of anything that may be happening. So one of the really good outcome that I see from this pandemic is the again another discipline that we picked up, having these types of events. But these are not the only events, but we did kind of restructure all of our um, virtual events. So I do want to make sure that our patients do have easy access for these. We have our 3 p.m. Wednesday every week, and then second and fourth Tuesday at 6 p.m. every month. And then first Tuesday of every month, we have our bariatric support group. And I do from United Medical ACU, I have a live session every Friday at noon. So these are our uh, pretty much this is our TV channel. So there are so many events that you can pick. And if you get really bored, and then we did customize our playlist based on um, how easily you can actually navigate in them and then find what you need. And hopefully this is helping everyone. So we are gonna try to do an even better job in time. But as we do more of these, I'm sure we are going to be able to do better. So, Dr. Anything you would like to say before we close?
Again, Kemal, thank you very much. I mean, this events, as you said, were a silver lining, right, when we started doing them because it enabled us to reach the patients virtually with, maintaining the safety that the pandemic demands. But I think we're accomplishing a lot. Clearly, a lot of education needs to be undertaken for people to know the availability of this important treatment for obesity, but also at the same time, we have to educate them on its magnitude, on its indications, on its appropriateness, and on the need to be associated with a very, very experienced program like ours.
So, how are you doing with the intermittent diets? Are you still keeping up with that?
100%.
100%.
How about you?
I'm 100% as well. So, actually, it's really working out extremely well. Like Monday through Friday is
That's
definitely
great.
100%, and I feel much better during the weekdays for sure. So it's working out. So
Yeah, I am a lot happier when I am able to practice what I preach, Kemal. So it's a good feeling.
that's great. Well, thank you so much again for joining us, Dr. Irgau, and all of our patients. So we'll be back next